And welcome everyone. It is the CuppaChino Club live social TV show. We've been going live every single day for about 39, I think today is our 39th show. And every single day we've been sharing how businesses and industries have been able to pivot with COVID-19. And today is no exception. We're going to take a look at the water sector. And we want to welcome our special guests for this evening, Benoit and also Dr. Anthony Turton. But first of all, let me also say a warm welcome to my co-host, Viola Manuel. Viola, welcome to the show.
Thank you so much, Brigetti. And gentlemen, welcome to the show. Thank you so much for agreeing to join us. New platform, we're quite excited about it. So I think we should probably just get straight into it.
Absolutely, absolutely. So COVID-19 and water in South Africa. What is the relationship? Is there a relationship that we should need to explore? And what do we need to know as members of the public? Anthony Turton, I'm going to go straight directly to you. What is the relationship and should we be concerned?
Okay, good evening, Brigetti, to the listeners. COVID-19 and water is a complex issue, and I don't want to trivialize it or oversimplify it. We'll have to unpack it because there are different elements to it. What I can say is that there is a growing body of scientific evidence coming from various studies throughout the world that virus is found in sewage and in particular is found in human stools. However, that does not mean to say that the virus is live. And that's the important distinction to make. So the presence of elements of the virus, pieces of RNA, does not mean that the virus is going to jump out and attack you from the toilet bowl. So we can unpack those things because it's actually a good news story because we can now use sewage to track the movement of the viral load through society, and I'm more than happy to expand as we go along. So in summary, water as a risk, specifically as a vector for COVID-19 is low. However, the fecal-oral transmission route is something that the literature does refer to, and very little is known about that. So that's something we can unpack as well. But the important thing is the use of sewage to monitor the viral load in society, and particularly how that ramps up and how it ramps down over time, and therefore becomes a useful input for policymakers. That's something that I think is a very good news story.
That's very interesting. Are there any use cases in other countries that we can draw on in terms of this knowledge base, or is it developing, and how does South Africa measure up in terms of what's already known out there?
Okay, the knowledge base on COVID-19 is growing exponentially. Just as the virus infection has been an exponential growth, so too has the knowledge base. 6 months ago, very little was actually known about it. Now suddenly there's a huge amount known. There's over 100 different entities throughout the world that are doing vaccine trials at the moment. Over 100 of them. Each of those have got many of the best brains in the world working on it. There's significant flows of capital into that space to fund this research. So I would almost suggest that we are probably doubling our knowledge on it almost every single day, just as the population of infected people are doubled. So we're learning a huge amount. What we do know is the peer review process tends to slow things down, because in order to publish something in a peer review journal, it has to go through various hoops to be vetted by other scientists, etc. And just because we don't have something necessarily in a peer review journal doesn't mean to say that with frontier science like this, we are not making major strides in new knowledge. And I'm happy to expand on that as we go along. But just in summary, there is a growing body of literature that has shown a number of correlations with patients that are ill with the virus and gastrointestinal disorders. So there's a statistically significant number of people that have gastrointestinal disorders. That's an important thing that we need to understand, and that has been reported in Lancet and various other prestigious journals. There's also been some limited, and I must stress, limited reporting of live virus in human stools, but that has been the outlier. It has been the exception rather than the norm. There is some suggestion that's not been verified. It's nothing more than a hypothesis at this stage, that there is a thing called the fecal-oral transmission route. So that opens up two avenues for our conversation. The one avenue is if a fecal-oral transmission route is viable, where are we likely to find that in South Africa? And how do we best respond from a policy perspective to that particular aspect? So that's the one thing that we can look at and we can understand. And then the other thing now is, from a fecal-oral transmission route, what is the best policy intervention? For example, in a high-density informal settlement, where people do not have access to waterborne sewage in their own homes. They make use of communal toilets. They also make use of communal standpipes to draw water from. So what is the transmission around the standpipes? Not necessarily from fecal-oral, but this transmission from people that are contaminated, collect water at a communal standpipe, and what needs to be done around that. These are two clusters of issues that are quite separate, and it's something that I put a proposal together to try and attract some funding that we could answer some of these questions in a very rapid way with the highest level of certainty, in the shortest space of time. So that's what I'd like to sort of state as an opening statement.
That's very interesting stuff that we do need to talk about. Benoit, just to bring you into the conversation, not that long ago, we were in crisis mode about water in Cape Town and in South Africa in general. And we have now, with the advent of COVID-19 and the lockdown, we've seen water tanks being rolled out all over the country. Anthony's touched on one of the issues there with regards to, people using those water tanks safely. Where are we getting that water from that is coming into the tanks? Is it sustainable? What's your take on that?
Thanks, Brigitte. I mean, firstly, going back to day zero and its imminent smash, that crisis actually brought water to the forefront of the water, waste and energy nexus. That's the first thing. What COVID has done is actually highlighted that the Achilles heel has not been addressed at all. And it's going to take 10, 20 years to address it. So, we wouldn't have expected it to be addressed. But what it's showing is that we have these crises, and they're highlighting that we are not a water secure country, and roughly a third of our population is not water secure and has to resort to tanks and the like. So unsustainable practices, not necessarily dignified practices either. But I think, if anything, what the lack of water is showing us, and I must say, is our dam levels are at 70% nationally, which is very healthy at the beginning of winter. And I think it was 37% for the Western Cape, which is relative to 2 years ago, quite healthy. It's not where it should be. It should be at 70%, but the country's got plenty of water. 2/3 of us have got plenty of water. Water is not an issue. A third of us, who are probably the most vulnerable from a food, water, and health perspective and immunocompromised, do not have water, easy access to water. And the water that's being brought to them it's the best unsustainable solution that can be put on the table. And the question is, when you decentralize like this, you cannot control the quality to the extent you do with pipe water to homes. So we in actual fact trying to help, but it's not very effective. But there's really, I mean, there's 25 years of economic distraction that results in a third of the population not having access, to reasonable water to wash their hands and the likes. And it's in the most vulnerable communities where this is happening. So to me, what's become quite interesting, very sad too, I must add, is that we've got plenty of water at the moment, and industry is not operating, as we know, at full kilt. Plenty of water, but we don't have it to everybody. And this is a very unique situation that we have in South Africa. In most of sub-Saharan Africa, we accept this as the norm. In South Africa, we're starting to accept that the rest of Africa's norm is becoming South Africa's norm. And we don't have water, we don't have waterborne sewage, and we don't have food. And there is no quick fix. You cannot engineer yourself out of a crisis. Engineering is done 10, 20, 30 years before. And to me, this is the interesting dichotomy. But what I must say is that if we do not embrace water and sanitation as the Marshall Plan, not post-COVID, because COVID is going to be around for the next 2 to 5 years, in the next 3 to 4 months, if you don't embrace that as our next Marshall Plan, then we will disappear into insignificance. And I think water is the single most important thing, because there is no substitute to that for our sanitation.
And can I just jump in here with a question? So what role of support are we getting from government, from national government and provincial government, in terms of the research that would need to be done? Have we had any indication from them in terms of the research you're doing, Dr. Turton?
Yes, I'm actually quite optimistic about that. I sit on more than one board, so I've got different vantage points. And I'm aware of some recent meetings with high-level officials in water and sanitation that have been extremely positive, been embracing of the initiatives being put out by the Water Chamber, which Benoit will hopefully talk more about now. But these people are very open and very, very positive. And I sense that what is happening is that the crisis in water has now become so acute. Of all government departments, arguably the most dysfunctional of all is water and sanitation. The department, relatively small department, but it's been looted the most. So the destruction of internal capacity, soft infrastructure, etc., has been so severe there that it's been felt acutely there. So I'm seeing a more positive approach, and I'm actually quite optimistic that there's a desire now to sit around the table. And for example, things that I've been saying now for the last 10 years, things that I've been talking about, managing water as a flux, not as a stock, starting to recover water from waste, starting to move to a circular economy. All of these things are now starting to gain traction. In different entities, you see these words coming up, etc. And I know from the literature on policy science, very often when a person like myself starts talking about these things, it often takes 2 decades, 20 years, for those ideas to take root. So the fact that it's only taken 1 decade is an indication that it's being fast-tracked. Maybe it's just that moment of crisis after crisis. As Benoit said, the first crisis was day 0, which was really a big, serious crisis for the country. Then it followed immediately after that now by COVID-19, which is a global crisis. So these 2 crises are compounded by things like our rating agencies downgrade, etc., etc. We're now starting to see one on top of the other, and they're all focusing attention on the fact that really we have to deal with our water sector. This is a foundation of all of our socio-economic stability, and particularly our ability to gainfully employ people when all of this crisis is behind us.
Okay. Benoit, just your perspective from where you sit, how has government been responding? I know even in terms of the Water Chamber.
So in terms of the water chamber, I must say we've been, since the lockdown, we've been very busy. So we're quite busy with the presidency and a few agencies and ministries involved in sorting out the pipeline of establishing water as a flux and not as a stock, as Tony says. And that theme, it resonates in the master plan, in the water sanitation master plan, but it's not that well marketed. And what we're doing is we're showing that you can make water bankable, for example, by reducing, so the old paradigm of, reduce, reuse, and then let's put some new stuff into it. And, 5 years ago, we spoke about on the augmentation, the new stuff, desalination, and between Tony, myself, and a few of us who are agnostic technologically, we see a shot at if we spoke about desalination, it's firmly entrenched now. So independent water producer term is firmly entrenched. Economic or independent water regulator, firmly entrenched. These are all things to make water bankable. So that narrative is, in actual fact, not only does it make common sense, is people have realized that we're in a corner and these are the only ways out. So from a water chamber perspective, is we've aggregated the private sector's interests as best as we can. And government said to us through the Public-Private Growth Initiative, they would get their house in order, organized and the likes, and both parties are doing it. And, to me, that's very encouraging, but we can't stop the momentum. We have to keep the pressure, and we do it through these type of forums, through consultation, through the PPGI, and through, I must say, I have not met anybody within government and state-owned enterprises who has said, Benoit, water chamber, Tony, you guys are smoking your socks. Not at all. It's how do we do it? Can you help us, etc. So I think it's very promising, but a lot of talk and the action. The problem is the action takes time because these things do not get engineered overnight. To give you an example, it's going to take us 12 months just to get transaction advisory specialists appointed to address on how do we make the top priorities, the catalytic projects, bankable. That alone takes 12 months, and that's from July this year to June next year. And that's just to scope what can be banked, etc., etc. So we've got the technologies. There is funding around, as we see in the world. Debt is an easy instrument to trade. There is plenty funding around. There isn't in government, but the other money hasn't disappeared. Okay, so I'm quite bullish. However, there's going to be very little demand for water and bankable type projects if you don't get the economy going as quickly as we can without compromising everybody's health. So, we've got a multi-dimensional challenge at the moment. It makes it very interesting and very complex, but in South Africa, we have the brains to do that. I'm quite sure of it.
Thank you so much. Just one question from one of our ladies when we started advertising the show. A very simple question: can the virus move? Can the virus survive in water? So if I'm infected and I wash my hands and I haven't used soap, I've just rinsed my hands in water, and I leave that little bowl of water standing somewhere, does the virus survive in water? Dr. Turton?
I'm not a virologist, so I don't want to speak out of my field of expertise. But what I can say is that the virus is actually quite a fragile thing. It is a little blob of genetic material, RNA it's called, and it is surrounded by a blob of fat. It's a lipid, and that's why hand washing works, because the hand washing breaks down the fat. Anyone that washes dishes at night will know that if you don't have soap, it's very difficult to get the fat off your dishes. But if you do have just a little bit of soap, you can wash your dishes very easily. So in the presence of even the mildest of soaps, the lipid breaks down. But what then happens, and maybe we can use this to springboard into another conversation now, is what happens is the pieces of RNA that are now inside that envelope of fat now become released and they start breaking down. But they still remain present in the feces, they still remain present in the wastewater. And those are the things that can then be detected later on. And based on that detection, you can now start very accurately calculating what the changes in your total viral load in the population that is being serviced by that particular wastewater works. So I hope I've answered that question. I don't think people should worry overly about things like that. It's actually quite a fragile little organism, although it can be transmitted very easily. So fragility and transmission are not necessarily the same thing.
So, given that, we shouldn't be too overly concerned about the lack of proper sanitation in your fragile communities, for example. I mean, sanitation facilities are non-existent to not very good in our fragile communities. People sharing toilets, and then my concern has always been those people come and they touch the tap. They may be washing their hands, but you've got thousands of people touching the same tap. What are the risks of contamination from that perspective?
Getty, that is a very, very topical point there. And I think we can maybe unpack that a little bit. Nobody has really gone beyond what the literature suggests, that there are reasonable grounds to suggest that fecal-oral transmission is at least possible, if not widespread. It's a theoretical possibility. So let's unpack that. Let's assume that there is viable virus in feces somewhere, although we tend to believe it's not viable. It's a dead virus that you find there. But let's assume that is so. How do you now overcome that? Well, you overcome that by basic sanitation, basic hygiene. So wash your hands after going to the bathroom. Now it gets interesting where you're living in a fragile community where hundreds, maybe thousands of people are using the same toilet day after day. Typically, such toilets are broken, they're dirty. So just by going into that place, you are starting to contaminate yourself. Now it gets more interesting, because whether the virus is present in feces or not is irrelevant, because there's a host of other nasty things you pick up under those circumstances. And once you pick up other diseases, other pathogens, now your health is compromised. And we know that this virus preys on people with compromised systems. So in other words, it's a complex little ball of wax. I think we should open it up. And I mentioned earlier on that we put out a funding proposal. I was the author of that, where we put out four streams of work in that funding proposal. And stream number 2 was to understand exactly what I've said now. What is the fecal-oral transmission route? Where is it likely to occur in South Africa geographically? What needs to be done in order to bring about a policy intervention to break that cycle so that we can overcome it? Let me just say one more thing. We know that while the virus is unlikely to exist in water, and certainly major entities like the Center for Disease Control in America and the European equivalent of that is quite adamant that water coming out of a wastewater works back into a river will not contain active virus. But now let us caveat that. We must understand the caveat. Both the Center for Disease Control in Atlanta, Georgia, and the European equivalent are working on first world assumptions that wastewater works are functioning up to international standards. We don't have that in South Africa. So we've got about 60% of our wastewater works are dysfunctional. We discharge almost 5 billion liters, or just under 5 billion liters of untreated sewage effluent every day into our rivers and dams. So we can't be lulled into a sense of complacency by reading a report from the CDC and saying that that is the case in South Africa. And there's one more thing I'd like to say about this particular topic. While the virus is quite fragile and it breaks up in the presence of fat and alcohol, we know that to a high level of certainty, but we also know that it can be a persistent thing on a surface. So for example, if someone is contaminated or someone sneezes or coughs over a tap, a communal tap, and someone comes and touches that, they've got virus on their hand, they then touch their eyes and their face, and that's the transmission route. So that's what we need to unpack in this stream number 2, work stream 2, that we can understand exactly what the steps are, that we can start intervening, because we think we're doing one thing, actually there's a different pathway. And what's interesting in all of this, what's known as a fate and pathway analysis, once you understand the fate of all of these things and the pathway that it takes to get to become eventual disease or an illness, etc., you can now know exactly which steps you have available to you for intervention to break that chain of causation. So it's a complex thing initially, but if you attack this thing systematically in a scientific way, unemotionally, pure logic, you can model this thing mathematically, and you can actually come up with very, very viable solutions that people might not have thought about had they not sort of broken it up into this logical chain of causation. What causes what to happen? Something is how, and then it causes something else to happen over there. What is that logical chain of causation? Are there multiple chains? What are the links in that chain? And this is where we want to go to on that second thrust in this proposal that we put through. And I must say that we've actually got interest from private sector capital to fund this work. So we're not asking government to come to the party with it, because once you get government money now, it suddenly gets complicated, because then you have to go through complex procurement procedures, and those things might take months and months and to get off the ground, etc. So we don't have the luxury of time under these circumstances. So we have to keep it simple. We have to ask basic questions, be logical about it, populate those questions with good, competent people, give them the resources they need, and expect answers not 100% accurate, but at least the most accurate answers we can get in the shortest possible time. But at least tell us what the envelope of probability is. So what is the upper and lower envelope of a probable outcome? We don't need 100% accuracy, as long as we know that it's better than 50% accurate.
A question I want to pose to both Anthony and Benoit. There's a storm in a teacup brewing about people wanting to return to water sport. There's various actions in process at the moment, people protesting, wanting to get back into the water. Given the fact that we have raw sewage going into the sea, what are the risks that people need to be aware of? And should we be doing something? Should people be going into the water? Should they not? What are your thoughts?
Benoit.
Yeah, from my perspective, I think you're tempting the devil, because I mean, this virus is airborne. It takes part in aerosols, it adheres to water droplets and the likes. That's why we need to wear masks, etc. So and it's very difficult to say you can do this water sport, not that water sport. So from my perspective, is no water sport. In actual fact, no sport. Virtual sport. At the moment, I see Germany is starting the first and second leagues this week progressively, but they're way ahead of the curve. We haven't peaked yet. So my personal opinion is that we have to err on the side of caution and make it simple: no water sport.
Anthony, your thoughts on that?
Look, I think I'm a purely logical person without any emotion about these matters. I think what you're going to start seeing in the near future is a dichotomy in the discourse, in the debate about these matters. You're going to see people talking about health versus the economy, and these are two sides of the same coin. You can't have a healthy society without an economy. You can't have an economy without healthy people. So I think there's going to be a growing tension between those two poles. And I personally am of the opinion that maybe the philosophy of humankind is a little bit flawed, in the sense that we want to hermetically seal ourselves off from a virus that we can never seal ourselves off from. We have grown up over evolutionary time to be exposed to things like this. And it's the exposure to things like this that brings about immunity. And while we are all very saddened and very alarmed by the death rate that's happening, there's also another story happening, and many people are getting better. And in fact, what I find interesting from a statistical perspective is that every day I watch on international news and I do the calculations about the number of people that have died and the total number of known infections. That number has grown up to over 7% globally now. It used to be around about 4 or 5% at one point in time. Now that is a misleading number because the number of people that, that are reported as infected are only those that have got symptoms and that have then been tested. We don't know how many people are asymptomatic, carrying a virus, but are perfectly healthy. We don't know. We simply don't know that number. And that is where this testing of the virus load in society using sewage is such a vital tool. Because what that can do now is, we know we've got 824 wastewater works in the country. Each of those has got a map, a plan. We know what the catchment area is for each of those sewage works. We know from existing data that we already have in computers in different places how many people live there. We can accurately calculate the viral load in each of those wastewater treatment works. And from that, we can see whether the virus load is growing, whether the virus load is decreasing. We can't say who has got the virus, but we can say compared to last week this time, we're getting more or we're getting less. And that is a very, very important thing because that will start filling in that missing gap of our information. How many people are actually infected and don't even know it? And those are the ones that are the carriers. And those are the ones that we need to understand before we can safely open up the economy again. So I've said a lot there, but I think we must not be overly zealous about this. And we must think logically about it. But I don't believe it's physically possible to live in a bubble. And I don't think it is psychologically healthy to become so afraid of everything that we don't want to touch anything anymore, that we become germophobic. We get some extreme people. Howard Hughes is as an example, that became so germophobic in the end that he lived a life of a recluse, a weird, strange old man, almost cut off from daily reality. And I don't think that's healthy either. So we've got to have a healthy middle of the road. And I think we must trust the science, and we must also trust government. And that opens up another can of worms, because how do we trust government in South Africa with our current record of abuse by government, of its responsibility of trust towards the citizens? That's a different conversation. But I think we ought to at least trust the experts on this matter.
How are we doing in terms of data capturing with COVID-19? Given our situation, we know that with the drought in Cape Town, for example, there was a lot of mistrust in terms of the data that was made available to the public. How are we doing in terms of data at the moment with COVID-19?
I can't give you an honest answer that I don't know. I'm not plugged into that side of things. I don't know. I've been focusing more on the technology of understanding the science behind the capturing of pieces of virus in sewage and how that gets replicated up and how that gets measured. That's where my focus has been. I can't give you that answer.
Benoit, any thoughts from your side?
I've been tracking it because the negativity kills me, and I've culled 50% of my Facebook friends, and I've got virtually 30% up on my LinkedIn connections. So, the business guys and girls got their heads screwed on right, I think. So what I'm understanding, and I like the analogy with day zero, and I got very upset in the day zero story where various organizations on the ground actually deliberately went to undermine government's attempts. And, water is managed by 3 tiers of government. And we know they are all dysfunctional to various degrees. However, they had the numbers right. That they had them right late is a different issue, but they had the numbers right. And if I have a look at the top universities in the country, the top international houses of academia that are linked to them, I believe we have the numbers right. In actual fact, it seems to be that apart from China, with the tracking and tracing, we are not only way ahead of the rest of the world, we've got a very unique approach because of TB and HIV/AIDS. So, you know, whilst we may be very decrepit, dysfunction in certain areas, we're actually quite good in fighting in a crisis. And, you know, my daughter works for a logistics company, and I think it's very relevant, is that they're one of the few, 50% of their competition has gone bankrupt in the last 5 weeks. They haven't. They've never had cash. They still don't have cash, and they're still surviving. Why? Because they got their fingers on the tip of the numbers. They're at the absolute leading edge, close to the bleeding edge. And I believe, and if I listen to our spokesman, I think it's Professor Karim, who's heading the epidemiology, I cannot say that word, side of things. And if you dig deep into what he says, there is nothing you can actually fault. So I was privy to the Boston City Group report and the likes, which was a global look. And they said that we would hit the peak in June, although it was more likely August, early September. Guess what? Our people are saying those numbers. So despite the challenges our government's got, I believe we have the numbers more or less right. And I do believe that if you look at days from the first infection, first known infection, there might have been some before, to what we've done, tracked and traced, we are in the league of Germany. Okay, and the Germans are way ahead of whatever's happened in China. We're not too sure. South Korea and the like. Singapore has been hit again. The Swiss collapsed completely. Okay, so if you have a look at also our mortalities, and I hate this because, you know, one solves too much, but the deaths per million, we are in the bottom 50%, not in the top 50%, where the EU and North America is in the top 50%. So I tend to say that I think we've got the numbers right. We had them right in water. We didn't use them adequately. I believe we've got the numbers right. And there's, you know, like the tariffs in day zero, the only blunt tool available to get the consumption down was put the price up by 200-300%. It worked in the rest of the world. It worked in Cape Town. It's uncomfortable. Over here, the lockdown, it's uncomfortable. It's killed my business completely, 100%. Okay, but the reality is I prefer to be dead and slightly hungry, alive and slightly hungry than dead and, you know, so there's, as Tony says, there's no discussion between, you know, we need a healthy society to have a healthy economy. And everything I've seen, apart from the shenanigans on the side, is we've got a good handle on the numbers and our healthcare system is ready. Our water systems are not ready. Our sanitation systems aren't ready. But we know those will take a decade to sort out, and it will take us 2 to 3 years to start seeing some results of that, but at least we start to get some traction now. So although I naturally distrust government until proven otherwise, I have enough of a fuzzy good feeling to say that we're on the right track, and the numbers tend to show that.
We're almost out of time, but I do want to ask as a final question. Given our water and sanitation situation in South Africa, are we disadvantaged, and are there any silver linings for us moving forward?
So, I don't think we have a huge, I don't think we have a huge disadvantage. I think we have people who are suffering, who can't get out of their suffering, 30% of our population. And it's a combination of hunger, lack of opportunity, lack of hope. So I think water is one of those. Okay, so I don't think water is really the determinant in here. It could help to alleviate the plight of the vulnerable. But I think from an overall economy perspective, right now we're using less water than we used to and less energy because industry is down. So that's the flip side of a lockdown economy.
Anthony, your take?
Yeah, look, that's a difficult question to answer. Now, I mean, the fact that we entered in this crisis with a very high level of unemployment already. If you look at global numbers, people are now suggesting that at global level, we might come out of this thing at 50% unemployment globally. So we almost had that number before we went into this thing. So we might come out with like 75% or something like that unemployed. Now, that's going to trigger secondary issues with social instability, rioting, stuff like that. So I'm not sure that from a national security perspective that we've got a lid on this thing. The soldiers are out there doing their thing, and frankly, I've been quite critical of what the soldiers are doing. I think they're roughing people up too much. I think they're alienating society. I've had a very vigorous conversation with my veteran friends because they will generally feel that the soldiers are doing a good job, and I think that they're actually doing a bad job because you don't want to go and rough people up. It's you don't want to alienate society from you as the security forces. So I'm not sure we're doing that well, but our infrastructure, our water infrastructure, particularly waste infrastructure, is completely on its knees. It is broken. It is as broken as we are going to get. So it's not an improbability that we start getting another catastrophe coming out of this one, some other multi-drug resistant pathogen emerging. And I've mentioned this many times. I gave a paper on this a while ago to the Association of Hospital Engineers, where they're looking at how to engineer the next generation hospital. And one of the things that's coming out of that very clearly is multi-drug resistant pathogens. And we are producing those things in South Africa because we're discharging so much waste into our rivers. And within the waste stream, we've got every conceivable drug you can imagine, partly metabolized, going through human bodies. So we are breeding very, very tough pathogens. And I think this is probably going to be the kind of thing, if there's going to be a 1, 2, 3. Now, number one was the day zero. Number two is the COVID-19. Then number three is the unforeseen thing we hadn't, no one thought about, and that's probably going to be some really, really bad bug that is only found here. It's a multi-drug resistant thing that we only get here. That's not a global problem at all, but it just basically breaks the straw that breaks the camel's back. I don't want to sound pessimistic on that note, but logically that tells me what's likely to unfold. What I would just like to say, please, if I just have a few minutes, if I could just explain how sewage can be used to monitor viral load. Can I just do that, please, Brigitte?
Go ahead.
Okay, so through the Business Water Chamber, of which Benoit is the CEO, we reached out to a Dutch entity called KWR. And KWR is a research institute in the Netherlands that has refined a technology that detects minute quantities of virus in feces. And what they then do is they first check the virus, because the virus is made up of very specific building blocks. So even though the virus is dead, the building blocks are still there. And they can detect these in minute quantities very accurately. And they then replicate those things through a process known as PCR technology, polymerase chain reaction. So think of a Xerox machine, that you put your virus into the Xerox machine, or you put the elements of the virus into the Xerox, and you now make lots and lots and lots of copies of exactly the same thing. So you replicate the numbers up until they are easier and easier to measure and to count. And from that, you can get a very accurate understanding, particularly when you compare it over time. So last week on Friday, we did a test. This week on Friday, we do a test over a 24-hour cycle. What is the load now compared to then? Is it bigger or is it smaller? If it's bigger, well, then something is happening upstream, and we need to understand it. So particularly now when we are talking about coming out of lockdown, one of the big early red flags that's coming out of lockdown is we see it happening in America now, where different states are champing at the bit and they're opening up maybe too quickly. Now they talk about a second wave coming. With the sewage surveillance, you can see that second wave coming even before people start reporting at your hospitals. So it is an invaluable tool for a country like South Africa. It's an accurate thing. It can't tell you that you have the virus, but it can tell collectively what the population situation is like in a very specific area. And that I think is very, very valuable. The good news about that is that private money is willing to fund this. So all that private money wants is an indication that government is interested, and government, by all indication, is giving that indication. So all things being equal, I don't want to put a date on it, but I would think that as soon as a month from now, I mean, it's that kind of time frame, we can probably start rolling this technology out into specific locations in South Africa. And we can very, very rapidly, within the next 2 or 3 months, start getting a weekly accurate results coming out of that. And that is what's going to inform the decision making as we decide to go from level 5 to 4 to 3, etc., etc. And particularly where you find one part of the country has got a crisis, and that has to go from level 4 back to level 5, but other parts of the country don't, so they can go from 4 down to 3. And with that level of pixelation, that's possible now because we know of the 824 wastewater works, which ones are servicing which community. We now know very accurately which areas have to go into a higher level of lockdown and which areas we can ease up on. So to me, it's a no-brainer. All the stars are aligned. It's an absolute no-brainer. We simply have to do this, and I'm cautiously optimistic. There was a meeting today with senior officials at Water Affairs, and they've expressed, I don't want to speak on their behalf, but they were certainly supportive of this idea. And it's my understanding that Benoit is very soon going to be getting a letter from these people in his capacity as CEO of the Water Chamber. So these things will happen very, very quickly now, and I'm actually very optimistic about that. And that's how I'd like to end this conversation off, on an optimistic note, that while the water sector is in disarray, we are in a position now through the chamber where we can realistically start thinking about raising the money needed. And just my closing final statement is, there's a new word that is now being bandied around by everybody in all kinds of places, and that is a thing called blended finance. And blended finance is probably the way to go in the future. And what blended finance is about now is different people with different financial backgrounds willing to put different bits of money into a pot for specific projects. So, for example, one of the problems in the water sector today is we don't have bankable projects. Why? Because most of the projects are run by municipalities that are themselves bankrupt. So you cannot legally enter into a binding contract with a bankrupt entity because they're not going to pay you back your money. So there's a way of getting around that. And in fact, there's a group of people now that are looking specifically at unbankable projects, and they're willing to put capital in to make an unbankable project bankable. And then they're willing to put seed money into that first bit of blended financing, where they will put almost sort of charity money, if you like, for want of a better word. They will put that money in to make that project bankable without any expectation of financial reward coming out. This is philanthropic kind of money. They will put that money in, but what that then does is it unlocks the Development Bank of South Africa. It unlocks the major banks, Nedbank, Standard Bank, all of the other major banks. They are then also willing to come and put in 5%, 3%, whatever, into the mix. So this notion of blended financing is now starting to come to the fore. And also, another word that's coming out of the conversation is a thing called a special purpose vehicle, an SPV, which is a contractual entity that enables the private sector to put money into something that's co-run with government, but it ring fences those assets that people can't steal the assets. So that's also a very interesting thing, and you're going to start getting a lot of pushback on that now, because vested interests that have been making a living out of stealing that money, they are trying to cut that off at the knees. They're trying to destroy that notion. But the honest people, they want that notion to go forward. So these are things we're going to start seeing coming up in future, and you might want to consider maybe interviewing specialists in this area or in these areas in the near future, just to try and explain and sort of open up that can of worms a bit more.
Gentlemen, thank you. Thank you very much for joining us this evening. Thank you so much for sharing. It's been an amazing discussion. I think the insight that we both have been able to just get out of this discussion together with our viewers. So thank you very much for being with us. Thank you for taking the time, and of course, just opening yourselves up to some of our questions. And we've got 2 minutes to wrap up. Any last words from yourself, Benoit? Anything from your side?
Thank you very much for organizing and to the viewers, and look forward to having a series of webinars where we can unpack all of these complexities in water, try and simplify it, and also gain, society's general appreciation and taking them up into how complex water is and how through everybody's inputs we can actually overcome them. So I'm quite bullish out of all of this. It's a tough lesson for all of us. I think we'll come out quite stronger. I believe in us. Thank you.
And thank you so much. Thank you so much. Anthony, anything from your side, just in terms of closing?
Yes, my closing statement is that human beings can live for weeks without food, for days without water, but not for a moment without hope. So I think it's important that we retain hope, that we retain credibility, and that leadership continues to be realistic in all of these assessments so that people can start actually building trust and not losing hope. Thank you very much.
Thank you so much. I think the conversation tonight has really just helped us to garner a lot more hope out of the situation. It was a very positive discussion, and thank you so much for sharing that with us. I think it was also a very real discussion about what some of the challenges are that we face. And to both of you, just from our side, good luck with your projects and your proposals, and we really hope that you get the funding that you require. And then, of course, just from our side, we salute both of you for the hard work that you're doing and the work that you're sort of doing behind the scenes to make sure that as much of this crisis can be averted as possible. So I think we're in a good space. I'm very proudly South African. I think, with experts like yourselves working as hard as you do, I feel that we really have our future in good hands. And so thank you very much. Brigitte, thank you very much for being so patient, because I mean, we've sort of run over with time. And then to all the ladies from the CuppaChino Club, thank you so much for all of you who are watching. Actually, gentlemen, today we have a little bit of history. You are the first gentleman to ever be on as guests on the CuppaChino Club. So we've been doing this for a long time. So we might even just send you a mug with that on it. So thanks very much for being with us. Thank you very much for taking the time to watch the show. Goodbye from Cape Town. Take care and be safe.
Thanks, everyone. Bye for now.
Bye-bye.
Oh, wow.